right, this is Dr. Jaitly. Welcome to the discussion of cardiology. In this study of the heart, we'll be talking about what is blood pressure, what the symptoms are, and what the damages are from having a high blood pressure. We know we carry a normal blood pressure called 120 over 80 through our arteries. Arteries are the vessels which are bringing blood away from the heart to the various organs and various extremities throughout our human system. Here is the aorta, which is shown in the outside of the heart, as you see, and as it emerges, it branches off, goes to the supplying the head, the upper extremities, the upper thorax or the chest, then the abdomen and the lower abdomen, the various organs sitting in your abdomen, and then of course your lower extremities. So our aorta is a huge vessel that comes out, and normally it has a wonderful lining inside which does not have any lumen obstruction. But over the age of 45 or 50, that's where the tiny little plaques, we call them, or obstructive patterns, develop throughout the lining of this arterial vessel. Now, if it begins in aorta, it follows that it also occurs in the rest of the vessels throughout the body. What are the symptoms? Now, for instance, if the changes are occurring in the eyes, there are changes occurring in the heart, there are changes occurring in the kidneys, there are changes occurring in the brain arteries, there are changes occurring in the arteries of the legs. And what are the symptoms as a result of all of this? Well, if it occurs in the eyes, obviously patients will start presenting with vision changes. That means more frequent changing of your glasses, or the prescriptions will change rather more often. Sometimes you may have even double vision, or distorted visions can occur, or sometimes blind spots can develop. So these are early signs of high blood pressure. Palpitations, of course, occur, because then the patients will start to say that they're aware of their heartbeat. Normally one is not aware of a heartbeat unless and until you ran a few blocks. I remember as a child, we all remember as a child, when we came running into the house from whatever field, football field or soccer field, your heart is palpitating, and that's your palpitation. So normally one does not feel a palpitation, but if somebody has high blood pressure, one would feel palpitations even at rest or during sleep or while laying down or sitting in a library, etc. You can feel the beat of your heart. Lessening of the urine output. When the urine output declines, that's a sign that arteries are hardening in the kidneys. And likewise, weakness in the arms and legs, that's a very, very serious or alarming sign, because by then the brain has already shown some changes in the arterial narrowing, and as a result one is starting to develop changes or more propensity, more predisposition, if you will, to develop a stroke. And pain in the legs, that develops only when the arteries in the legs, they start to narrow. When the arteries in the legs, they start to narrow, narrowing implying the flow is getting compromised, so one tends to walk like a block or two and start to feel the pain. So a patient will, or a person will classically give you a history or feel that he or she was able to walk 10 blocks or walk to the bus station, now has to stop in between, or cannot go up the train station without stopping in between the steps. So these are some of the indicators that one should keep in mind, and these are your symptoms of hypertension. Hope you enjoyed this section. More later. We'll keep it interesting, guys. All right, bye.